Okay, so I want to share with you all this super awkward experience I had when talking to my physician about using natural family planning. This is something that I think a lot of women are afraid of, is what kind of resistance they're going to get from their healthcare providers. And I can say you're probably, depending on who your providers are, you probably are going to get some, because a lot of physicians, nurse practitioners, PAs don't have a lot of experience or awareness of NFP or fertility awareness-based methods. And so take it as an opportunity to teach them or challenge them to learn more about it. I was very intimidated to do that with this physician that I was seeing when I was starting some clinicals for school, for physical therapy school. I needed to get all these vaccinations to go work in the hospitals. So when I went in to get these vaccinations, the doctor was reviewing my medication list, which was nothing, more or less, and said, "And what do you use for contraception?" And I said, "Well, I actually don't use contraception, and I just got engaged, and we are planning on using natural family planning." And that was the first time that she kind of gave me a little bit of side eye and was like, "Okay, well, that's not a very effective method. I hope you're open to getting pregnant right away." So fast forward to the next year when I needed a couple other vaccinations, a couple of other tests, like tuberculosis test. You do that every year typically with school. And when I went back in, saw the same doctor, she remembered that I was using natural family planning. And when I went to get my, it was a hepatitis vaccination, she said, "Well, I'm going to have you take a pregnancy test before I can give you the vaccination." And I said, "Well, I know I'm not pregnant. Here's my chart. Just started a new cycle, so I know I haven't ovulated. I know my body is telling me there's no way I'm pregnant." And she said, "Well, you're not using contraception, so I have to do it." And I said, "Well, my method of natural family planning is as effective as your method of contraception you're trying to give me to avoid pregnancy. So I hope that you're asking all of your other patients that are using condoms, for example, for birth control, to take a pregnancy test as well before you're willing to give them their hepatitis vaccination." So she didn't love that. She didn't love that response. I don't think she was very used to being challenged in that way. And she said, "There's just not research backing up what you're saying." And I said, "Give me your email address, I'll send it to you." I did send it. I never got a response. So I'm hoping she opened it, looked into it a little bit. Odds are she probably didn't. She probably just said, "That's just another one of these students giving me a lot of sass." But I felt a lot better that I had at least advocated for